It doesn't have to be anything, unethical. It doesn't have to be anything incredibly harsh. And that's kind of what we're going to talk about with some of the specific interventions from real cases that I'm going to be telling you about today. First off, we have to touch on the ethical piece, though. Ethical piece for punishment is incredibly, incredibly important. You have to follow every ethical guideline that you possibly can with punishment in order to use it the proper way. So these are noted, these are just from the board's ethical guidelines here, 4.05, reinforcement before punishment. This is the one that pretty much everybody knows. All right, we have to start and exhaust all reinforcement opportunities before we even consider punishment as an option for the most part. Sometimes the immediate cessation of the behavior is preferred or required for safety. There are cases where you might need to go right to punishment because something is life-threatening or there's serious injury potential to somebody who cannot defend themselves. So you might suggest it or entertain the idea, but really we got to try some reinforcement first, even if it's just a DRO or DRA. It's just differential reinforcement. All right. Least restrictive procedure. All right, this relates directly to what we're talking about for what type of punishment procedure you're going to choose. All right. We always choose the least restrictive procedure. I have such an issue when I walk into a place and I see a behavior plan that's 8 pages long. Okay? I don't care if all of them are like reinforcement and token systems, visual schedule, everything like that. If you have an 8-page behavior plan, that's not least restrictive. You're still doing too much. Okay? We don't need all that stuff in the treatment package usually. An example for punishment would just be to use positive practice potentially before a contingent restraint. Obviously, a contingent restraint is very, very, very restrictive. Right? One of the most restrictive procedures that you'll see for punishment. Next one is termination criteria. Really important. Okay, you got to know when to stop. That should be identified from the outset of the treatment plan. If you're incorporating punishment, if you're incorporating anything, but specifically for punishment. Punishment's one of those things that once you have it in place, it can be really, really difficult to fade out. It's one of the knocks against punishment. Another one is that it doesn't teach an alternative behavior to replace the problem behavior. But you've got to have a plan to fade punishment. All right, and I'll show you exactly how we did that in both of the cases that I'm going to talk about in depth. If you're going to use punishment, you should have an FBA, you should have a function. Everybody knows that you don't want to reinforce the behavior, the problem behavior, and there's different types of punishment that can do that. If you have an individual that engages in aggression with a function of attention, you're not going to use a verbal reprimand. All right? How many people in here see that anyway? Right? It drives me up the wall sometimes when I see teachers yelling at kids, and I'm like, God, somebody else has tried that. It doesn't work. It's not getting any better. Okay? And then timeout is another big one. Brett's going to talk specifically about the guidelines and the safeguards for timeout procedures. But if you have an individual that engages in self-injurious behavior with a function of escape from demands, you are not going to send a kid to timeout, especially an exclusionary timeout. All right? And you're not going to do a timeout from attention if you have a function of escape. Treatment efficacy. This is a big one that people don't always tie into punishment. All right? Always use scientifically supported and most effective treatment procedures. Really, really, really important. Oftentimes when we look at using punishment, we don't do the proper assessments. We say, oh, he doesn't like this, so let's try it. Or we're going to try a reprimand. Or we're going to try a timeout. Okay? There's the stock ones that we're always using, even though they might not be effective. A good way to judge if your timeout procedure is effective, do you have immediate results from it? If you don't, you need something else. Right to effective treatment. Again, that's one of our core ethical guidelines. Every client that we have has a right to effective treatment if we're providing services for them. And then really looking at that risk-benefit ratio and the side effects of what you're going to do to determine if it is the right procedure for them. And when I'm talking about risk-benefit ratio, it's simple. You know, what are the benefits from using this, and what are the possible risks? And you look at that, and you want that number, you know, to be really, really small. Okay? You got the risks over the benefits, nice fraction for you. And if there's very minimal risk and a huge upside, then it might be the appropriate procedure. Now, we're going to get started on that stimulus avoidance assessment. How many people in here have been through the Fisher et al. 94 article? Okay. If you haven't, I recommend it. It's awesome. It's important to select appropriate punishers, like I said. You have to conduct a stimulus avoidance assessment if you're going to even identify what might be an appropriate punisher. Then you have to do a punisher assessment to see if it actually has punishing effects. Just like with reinforcers, we might have preferred items identified through a preference assessment, correct? But they might not function as reinforcers. Happens all the time. They're saying, well, you know, every time he finishes his work, I give him a Dorito, but he's still engaged in problem behavior to get out of work. Maybe they don't like Doritos that much. Maybe they don't reinforce that behavior for you. Use of punishers with sufficient quality and magnitude. Magnitude is huge. It's a really, really important piece, and Chris is going to talk about that a little bit more later too, but I can't stress it enough how important the proper magnitude of a punisher is. Okay? You can't ramp up to punishment. You got to determine what the appropriate amount is from the outset. And then the schedule. Schedule of punishment, there's, you know, research here and there that says a couple different things, but for the most part, it points to, you know, almost that continuous schedule. That FR1 for punishment, response punishment every single time. Intermediate or intermittent schedules can actually decrease the effectiveness of a punisher, even if you use it on an FR1 schedule after intermediate schedule. Okay. I'm sorry if, you know, some of my people who aren't behavior analysts are you'll understand in a second when I talk about it.